Perfect. Thank you. Oh, all right. Perfect. Well, welcome everyone. Thank you all for taking some time on a afternoon. I know it's a little bit before 5, so maybe some folks had to pull out from work or wherever it might be, but really appreciate all your feedback. Oh, do you want to grab? I'm guessing Jessica.
No,
Oh.
this is Stephanie.
Oh, sorry. Anyways, okay. Sorry about that.
Okay.
Again, appreciate you all taking a little bit of time to join. The first thing we're going to do is really just go around, but this is the first committee meeting for the STEP Advisory Committee. We'll go through this a little bit later, but we're going to have monthly meetings. We have kind of a couple of topics that right now are our assumed topics for month by month, but we'll kind of go through them in a little bit. They are subject to change a little bit depending on availability of some folks. So today I'm going to go through committee introductions. We're going to talk about a little bit of the overview of the committee. We're going to do the housing framework and then the discussion and next steps. So we do have a couple discussion questions, kind of high level, just to get one broader understanding, and then two, make sure we're getting enough feedback to be able to respond and provide you all the information you need to have a good committee. So I think with that, we go right into introductions. So I can go first. My name is Nick Chen. I work with a consulting company called Kimley Horn. I have an urban planning background, urban planning and landscape architecture, actually. So I've been working with the city on a number of different projects, middle housing being one of them. And as I go through, my role here is really to help Debbie to facilitate this group. Discussion is really amongst you all as a committee. And so providing resources that you need, if it's technical resources or tracking down questions. Ultimately, I think compiling potentially responses to any potential amendments we might make and recommendations. So that kind of technical facilitation help that you all might need. So if you have questions, feel free to ask. If I don't know the answer, I will do my best to track it down and get back to you all. So with that, Debbie, do you want to go?
I'm Debbie Bent, the Community Development Director. So code amendments usually fall within part of my department's responsibility. So Nick and I are here to help the committee and provide information that you need so that the end result of this committee is providing a report to the council on some recommendations for code amendments related to STEP housing. Looking at perhaps some community engagement materials that will, help as this kind of housing comes forward with an actual application in the future. So again, thank you everybody for being here. Brittany?
Yeah, so hi, my name is Brittany Chu. I'm Summer Senior Planner here. I work with Debbie, and Summer's here to help support this anything.
Timothy Marcello. Here to help.
Appreciate it. Sorry, I should have said, yeah, if anybody wants to give any bits about their background or anything like that they think might be useful, they want to share, feel free, or you don't have to. Okay, Jennifer.
I'm Jennifer Alderman.
Thank you.
Hi, I'm Karina File, Kenmore resident of like 36 years. That ages me a little bit. My background is in policy and advocacy efforts and behavioral and social health. And I'm just wrapping up my public health degree and doing some work for the Red Cross.
Yes, congrats.
Yeah.
Right. I'm Josh Krasinka. I've lived in Kenmore for just over a decade now.
Awesome.
I'm Catherine Sullivan. I've lived in Kenmore for about 12 years. Would probably best describe myself as a housing obsessive, but professionally I'm a real estate broker, work with investors and infill developers for the last 2 years. And before that, I was a full-time artist for about a decade.
Awesome.
I'm Juliana Cooley. I was born and raised in Kenmore, so can't quite say I've been here 36 years because I moved out of state for college and grad school, but it's put in a couple decades here too. Similar to Catlin, I really, really love housing. I have a master's degree in community and economic development with an emphasis in housing and homelessness. I love research. I love writing. I love citing my sources. I have family in the area that are aging. I have family in the area that's disabled. Living here a long time means I really care about people who have lived here a long time and maybe their evolving needs.
And just, I don't know, I've loved Kenmore and I've loved Kenmore for decades.
My name is Maddie or Madeline. I'm not sure what it says, but either one is fine. I was born, well, I moved to Kenmore when I was 2, and I've lived here ever since. I'm currently in grad school for a master's in teaching, and I'm a swim coach. I work at Aqua Club in Kenmore. And I'm teaching middle schoolers right now, and learning a lot about like homelessness and kids who are struggling with things like that. So yeah, I have a lot of different experiences, and
Well, thank you.
Steph, I don't know if you want
Yeah.
to say a few
Love
words.
to. So I'm Stephanie Cash and I'm the interim city manager here at the city of Kenmore. And I wanted to come to your first meeting and say thank you to all of you for stepping up, volunteering to help with this. It's fun to see some familiar faces and folks who I know have been involved and engaged in city business and city efforts for a long time. This work is really important and it really will help us as we move forward and think about all the important decisions that are coming and how do we balance all of the competing interests and hold many troops at the same time and figure out how to move this work forward. And this can be really key to that. And so I wanted you all to know how much I appreciate you on behalf of the whole city staff and the council. We thank you for volunteering for this. And I know it's going to be a time commitment and that some of these meetings might, be long or hard, and we just look forward to seeing how this all goes and here to support you every step of the way. Just really appreciate you all. So I'm gonna be here for a little bit and then I'm gonna pop out, but I'm just excited to be part of it and
Perfect.
thank you for everybody's help.
Thank you, Stephanie. Okay, well, appreciate everyone. At a couple of these meetings, Clay White, who works with me as well, will also be here. He's not here today, unfortunately, but he will be able to attend a few of these other ones. So a couple just high level expectations here. I think most people here who signed up and read the project charter and probably understand this is a topic that people have really passionate feelings about. You all kind of expressed that as you went around the table as well. As we have, those feelings and express them, just as a group come to these meetings, prepared and willing to listen with an open mind for others who might, think differently than you all. Some folks may have more of a background in housing and homelessness and step housing in general. Some it may be a fairly fresh topic. Everybody's opinion in terms of that is very valuable because it's in terms of the background that everyone has. It brings a fresh perspective that we can use to incorporate, and it probably is very representative of the city of Kenmore as a whole. Some people in Kenmore are going to be very knowledgeable about housing, others are not going to be as. So I think in this committee, we have a good cross section of folks to be able to work through this. Work together as with other committee members to develop an advisory report. As Debbie mentioned, that is the ultimate goal of the committee, to provide the city council in the time available. We'll go through schedule in just a little bit. Maintain focus on the Kenmore community at large in this work. And then lastly is just sort of a logistical point. There are no alternatives. So if for any reason you can't attend the meeting, just let maybe Debbie know ahead of time if you can't attend, or ask somebody to present maybe some of the portions that you want to bring to a meeting. We'll be able to accommodate, but we're not going to swap or anything like that. So with that, we'll get a little bit into just expectations. So first is study and understand the step housing topic. We'll get a little bit more into this, but step housing is emergency shelter, transitional housing, emergency housing, and permanent supportive housing. We have a couple slides on the commerce guidance and some more descriptions in terms of step housing as a whole, but we're also going to be providing a lot of resources. And so that being said, if there are certain things that you all have in terms of questions or resources that we could help provide or topics that we could help dig into a little bit, we would love to do that. So a little bit of this first meeting is figuring out like a baseline of where everyone is and also trying to understand what may be needed in terms of resources to best work going forward. City staff will provide resources, that's myself included as a supportive city staff, and then provide options for potential code amendments. Again, that'll be one of the topics we discuss as part of the memo that goes forward. advise on and assist in the community engagement process. That we talked a little bit about the potential community engagement process we do as part of this. Still not fully fleshed out in terms of what that will look like. I think it's part of the charge of this committee is to kind of decide how best to engage the community and then work with city staff to be able to logistically work that out. At these meetings, I think we took this right from the project charter, but y'all are certainly welcome to attend, but really listen and observe rather than kind of lead and try and direct people one way or another. When we go to community meetings, you really want to just mainly listen, myself included, to what people want to say. And so as we go through and we hold those different meetings, whatever form they might take, that'll be our primary purpose. And then lastly, create a community advisory report for the presentation for city council. So I'm going to go just a little bit into step housing, and I apologize, this is going to be really small. We can make sure you get all this information and the links that are all here and everything. But as we go through, this is a direct cut from some direction that Commerce provides. I can read it out in case folks can't see it. And part of my screen block, but I have it here. So just to make sure everyone's on the same baseline and I'm not mincing words or anything. Emergency shelter is a facility that provides a temporary shelter for individuals or families who are currently experiencing homelessness. This includes day and warming centers that do not provide overnight accommodations. For transitional housing, the project that provides housing and supportive services for up to 2 years or longer for individuals or families who are experiencing homelessness. The purpose of transitional housing is to facilitate the movement of people from homelessness to permanent housing. Emergency shelters, temporary indoor accommodations for individuals or families who are homeless or at the imminent risk of becoming homeless, is intended to address basic health, food, clothing, and personal hygiene needs of individuals or families. And then lastly, permanent supportive housing. Subsidized leased housing with no limits on length of stay. It's designed to support people who are experiencing homelessness or likely to experience homelessness before moving because of their complex and disabling behavioral health or physical health conditions. Residents are provided with supportive services such as mental and physical healthcare and employment services to help them stay housed. Permanent supportive housing often has less strict admissions criteria than other forms of housing, especially related to rental history, criminal history, and personal behaviors. So again, that's directly from Commerce. They actually have a number of different resources, some of which we put in the agenda, and some of which we provided in the presentation as well. So if you want to go to, if anybody wants, it doesn't have sort of an electronic copy where these links work, feel free, we can always send a version of that where you can click on those links. So there's a couple of resources there, including just general definition of STEP, project website that the city of Kenmore has, some information on House Bill 1220, and then again, Department of Commerce user guide for STEP housing. So purpose of this committee is to, and I realize, I think I maybe can move this off screen so it's blocking. There you go. Cool. The objective of this STEP advisory committee is to provide an advisory report roughly by the end of September 2025 and propose amendments to the city's zoning regulations regarding STEP housing. Ultimately, City Council will make the final determination approving amendments to the Kenmore Municipal Code, but the intent of this committee is that they pull recommendations and potentially pull portions from this as they see fit as a governing body. Tentative work schedule. So a little bit about this. We mentioned we'll probably have about 6 meetings. So we're past March now, establishing the advisory committee. The advisory committee is established. We are all here. So perfect, got the first step down. Committee meetings run roughly April to September. Again, that's 6 or so. It says 8 here because that includes some council meetings as well, potentially. So as we go through, we have about 6 on the next slide that have topics assigned to them. Committee presents in September the advisory report on STEP housing amendments to City Council. The report may identify a preferred option if the committee chooses to do so. And then lastly, somewhere in the September to December timeframe, the council considers the advisory report and gives direction to city staff on proposed amendments to include in an ordinance. City Council will hold a public hearing by the end of the year to consider the ordinance by the end of the year. So with that, I'm going to stop for just a second and say, does anybody have any questions just kind of procedurally on committee and what we covered so far? Okay, pretty straightforward. Perfect. Feel free. This is, again, pretty informal. Feel free to stop me at any point if you have questions or you want us to cover something in more detail. So on those potential committee meeting topics, in April, this is really setting the baseline. We're gonna review documents. We're gonna talk a little bit about step housing. The charter that the city prepared that you all responded to in terms of getting on this committee. We have some potential questions at the end of this presentation that are really discussion questions, and that's where really I think we're going to get the most benefit out of is starting that discussion right now. So, and then talk a little bit about community engagement options as well. The intent right now for May is to have a discussion with a panel of step housing experts. They could be housing providers, ARCH staff, staff from other jurisdictions. We haven't set that group together just quite yet, but looking to get that set together and then have them provide feedback on step housing regulations, and similarly have you all get the chance to ask them questions about their expertise in that topic. So June, we're looking for a debrief from that panel discussion, including key takeaways. Then we'll start to review and discuss potential code amendment options to go into the memo at the end. Then we'll continue review and discussion of code amendments and a potential community open house. And then after that, identify preferred topics or preferred recommendations going forward. And lastly, present those to City Council in September. So yeah, that time frame goes from here to September, and then council may take action after that. Karina, you had your hand.
Yeah. So we have a pretty robust committee. I do notice beyond the housing experts and a number of different community experts of various types and backgrounds, who we don't have and who's not at the table and part of the discussion or plan to be part of the discussion are people who are served by these communities. That's a requirement of Washington State to have, diverse representation. So when we're talking about people of the community that we're serving, they're supposed to be part of that conversation. I would argue that we need to find a way to create space to ensure that there's both an opportunity for voice and a seat at the table.
And just so I make sure maybe that I'm understanding you, when you say people that are served by this committee or the community, are you talking just largely the community folks in general?
Yeah.
Okay.
Yeah.
Perfect. Making sure.
So your thoughts are invite homeless or potentially homeless people to join the committee?
So one of the great ways of working around issues like this is reaching out to partners we have established and looking for volunteers within that community. Oftentimes we find great connections and resources. I think Julianne and Pulley would also have some recommendations that would work well here, but usually that's a good mode of practice to go through in a best standard approach.
So I think Debbie, you might be able to help me out procedurally in terms of committee members and how that gets established, but I
So
think
so the purpose of the committee members was to get Kenmore residents,
Mhm.
and that's why you all applied to serve on the committee. So you are the representing the committee. Granted, you might not be a resident in one of the types of housing here, but you're to give sort of recommendations on the regulations for that type of housing. So I think you're kind of, I'm trying to figure out how that conversation would relate to the task in front of you right now. When we do have, if we do have a community meeting, we know that will be widely advertised, and if there are any recommendations for folks to attend, that would be great. We'll also make sure that we involve the providers of this type of housing, because we want to make sure that the regulations that are established work for the providers. And then also part of the task here is to figure out the community engagement piece to make sure that works. Things like good neighbor agreements, which often providers establish. So I think, there is the opportunity, but again, when the council decided to set up this committee, they really wanted to make sure it involved broadly Kenmore residents. So
I will say two things, Karina. I do know that I sent along the step housing to people who had lived in some of these step housing things to people who are Kenmore residents, and they decided not to apply. So we did do outreach, or at least I did outreach. And also I think that with what I'm hearing, Debbie, is I know sometimes we have housing service providers that have also, maybe lived in shelter as a child and now they're a service provider. And so they can, so I think when we are listening to our experts or getting our panel, if we can just make sure that they are
Yeah.
providing feedback, not only as an expert, but also providing feedback from lived experience, either from their own residents or from themselves or from someone else, because we don't want to just be othering, you know, these other people, but recognize that
Right.
many, often they are Kenmore residents. You know, we do have, you know, we have shelters in Kenmore.
Right. So for example, the Nothing About Us Without Us Act that was adopted here in Washington State specifically says that it aims to ensure that individuals with lived experiences are included in the policy, making that directly impacts them. So that's why I made the statement and argument. And I think amongst us, we have a variety of both backgrounds of lived experience of different varieties. I can't say that all that representation is represented here at the table today, but there's a way to get there. And it doesn't have to be hard.
I also would say, I know in other settings, I would never want someone to be put on the spot, especially at intros, to say that
Right.
that's the reason why they joined, because we could have experience here and
Right,
they just met us.
exactly.
So I wouldn't,
Yep.
I wouldn't say, you know, Jennifer, I just met you, but do you have lived experience with homelessness? You know, so we shouldn't be also assuming.
Right, those
If
are
anyone
private,
does have these experiences just because they didn't offer it in their intro.
those are pretty private discussions to
Exactly.
have behind the scenes and maybe bring some.
That should not be a disclosure that's
Someone's,
required.
but I just want to make sure we're being cognizant of our practices, you
Yeah,
know?
I appreciate that. And maybe as we go through sort of the housing expert discussion or the community engagement process, there may be a way to factor in feedback from that community specifically. If that's a desire of this community, it wouldn't necessarily be through a direct community member or committee member, but it could be a way to engage folks who have that experience, who could share it and then benefit the community in that way. So. Great.
One just clarification question, because there's obviously
Sure.
the planning committee too, that addresses a lot of this, yeah.
Right.
So is there a preset recommendation from that commission that we're starting with, or is this
No.
an addition that we are
No,
adding on
the
to their?
planning commission is not involved in developing these regulations, so the council wanted to set up a separate committee, which is this group, to provide that recommendation on the regulations. So the planning commission will not have an involvement in this. Your recommendation is what goes forward to the council for consideration.
We're just a community feedback group, right? We
Yep.
are not.
Yeah,
Yes, that's a good clarification.
different code,
We're just a different.
different code.
Great. So a little bit on the STEP committee framework, and then we're gonna have some time for a discussion afterwards. So overview, just a broad level overview of House Bill 1220. It was enacted in 2021, changed the requirements of jurisdictions fully planning under the Growth Management Act, including Kenmore. Cities are now required to plan for and accommodate housing affordable to all income levels, including STEP housing. And this encouraged jurisdictions to review their housing element policies. Kenmore obviously adopted Kenmore adopted the comprehensive plan at the end of last year. Required jurisdictions to review their housing element policies and assess their performance in implementing development regulations and programs to facilitate all housing at all levels, including STEP housing. So cities, some of the requirements under the Growth Management Act for STEP housing, cities may not prohibit indoor emergency housing, which includes traditional shelter arrangements in any zones in which hotels are allowed, with some minor exceptions. So this is actually a change that Kenmore, I think, is currently making or has already made in terms of allowing emergency housing in all zones where hotels are allowed. Each jurisdiction must identify sufficient capacity of land for a variety of housing types, including emergency housing, emergency shelters. We're going to talk in a slide or two about housing there in terms of existing housing and then identification of opportunities for housing for emergency shelters and permanent supportive housing as well. And then jurisdictions should consider the following, considering restrictions to code updates related to STEP housing. That's occupancy, spacing, and intensity. So if jurisdictions are going to create different standards in their code regarding these types of housing, they should think about how they restrict occupancy, spacing, and intensity, because those sometimes are the most restrictive components of these types of housing, and they cause cities to not be able to develop those things. So some more local context, as part of the most recent update through 2044, the city was allocated a total of 487 net new emergency housing needs. That's approximately 30 a year. Emergency housing includes emergency housing and emergency shelters. And in addition to permanent housing needs, there are currently 33 units of emergency housing in Kenmore. Kenmore currently allows emergency housing in, I'm gonna get this wrong in terms of downtown commercial, urban core, waterfront commercial, and the last one, regional business. That's right. I knew I was gonna miss one, but so allowing it in those zones as well. Kenmore will need to modify a few definitions to more clearly describe. Previously, actually, before some of these revisions were made, Kenmore had some requirements in there regarding total number, I think it's 50 or so, in terms of a cap, and also some restrictions on consecutive number of days and how many you could have in a calendar year, and I believe those have been removed, requirements. So as we go through, on permanent supportive housing, the city was also allocated this is separately, total of 539 net new permanent supportive housing units at the 0 to 30% area median income for 2044. This is approximately 27 per year. There are currently no permanent supportive housing units in Kenmore. As Kenmore went through the land capacity analysis and identified whether there was capacity to accommodate permanent supportive housing, they factored in the areas where this housing could be built and then applied, just like for the land capacity analysis that was done for all the other income levels, apply the market factors that would remove out properties that may not be likely to redevelop or may not be able to redevelop, and then pull the portion out to be for specifically the 0 to 30% median income. And it got to, I believe, about 1,700 opportunity for about 1,700 permanent supportive housing units. So just a little bit of background on the city's process as they went through the land capacity analysis as part of that comprehensive plan update. And then lastly, Commerce recommends the cities engage step service providers to better understand specific emergency housing demands, constraints, and opportunities within their communities. Also engage the community to understand what is important to the community in relation to step housing. So both of those two topics we've kind of covered in terms of engaging step service providers and experts in that field, as well as engaging the community at large regarding the topic of step housing. So both are goals of this committee, and we'll kind of work towards those different individual meetings, but we plan those to be separate. So we didn't want to take up too much time on presentation. Before I go to discussion next steps, I did want to go into any questions on anything that we covered so far. There are going to be 4 discussion questions after this, so there'll be plenty of time to talk about broader questions, but just wanted to make sure covered everything that we went through.
How are those unit targets set, and how do they compare to the neighboring communities?
Can't tell you how they compare to the neighboring communities necessarily, but yeah, so they're set, they're allocated to individual counties, and then counties develop a methodology for distributing those amongst the cities. And as they go through, city ultimately gets a portion of the overall county based on the countywide planning policies and the methodology that's set by each individual county.
So the growth algorithm on how quickly, yeah, they have a growth algorithm with the population.
Yeah.
Yeah.
And I don't know exactly how it compares to some of the allocations that some of the others got, because we didn't necessarily work with those communities, but it is available online if you wanted to take a look.
This is a very intensive dashboard. If you want to hear, like, our
Yeah.
allocation is like
Yes.
tiny compared to Bothell, and like, yeah, it's all transparent on how we're specific.
Yep. Okay. Well, with that, we have a couple discussion questions. We'll start at the top, and again, this is open discussions. We're grabbing notes. This is again really to help us get a baseline to understand where you all are coming from, where we can provide the most value in terms of our involvement in the committee, and how we kind of facilitate that discussion going forward. So first one, knowing the requirements that Kenmore must meet, and by requirements, we must be talking about the unit allocations that we just talked about. Where do you see opportunities to provide a greater variety of housing types for community members, with the focus of this community being step housing? With that, I will open it up to anybody who wants to talk. And this could be where geographically, it could be where in terms of different zones, it could be where just broadly in the community, you've seen, opportunity for this.
So when I was reading that very long packet on step housing. That was from November. I was like, I gotta read this whole thing before today. It sounds like anywhere where multifamily housing is permitted, then now has to require step housing. Did I read and interpret that correctly, or is that up to the individual cities? I know you can't prohibit it where hotels are allowed, but it sounded like the new regulations were at least some types of step housing to be allowed in multifamily. Which is.
Yeah, generally it's where multifamily is allowed.
Okay, so that's now, well, according to the planning commission's proposal, all R4 and R6 zones with middle housing.
Well,
That's still,
Yeah,
that's still single family
that's-
zone,
It's
so
been
it's
adopted, yeah.
probably more above that.
yeah, those are multifamily housing types because they provide more than one, but I think a lot of this is going based off the intent. The intent is not to have it be in R4, R6, like in single family zones. I guess the intent of that legislation is to have it say in multifamily zones like your downtown core and like those areas.
Okay,
So, but that's a good clarification, actually. We can see if ultimately when middle housing, if it does get adopted, if that does change the locations of where that might be.
In the current zone, like if you go back to the 4 or 5 areas, downtown core, waterfront core,
Mhm.
what exactly does that cover currently? Because I know that's been being adjusted.
In those zones.
Yeah.
Is the city doing rezones of like reallocating where areas the different zones are, or just as part of middle housing, modifying existing zones?
Middle housing is only applicable to the R6 zone and R4 zones
Yeah.
outside of, if they're not adjacent
they're
to waterways,
identified.
that's the proposal,
Yeah,
not in R1. So that's where middle housing,
yeah, but the city's not
But there's
proposing
no-
any
no,
changes
there's
to
no
the
other-
boundaries of.
no, there's
yeah.
no other change, currently being discussed about changing the boundaries or expanding any of the other, geographic areas where those zones would apply.
And we can provide a map.
Gonna say, is there a way to get a graphic of those?
Yeah.
no cloud starting back, because it's not a lot of the land area, and it's all
Yeah.
fairly concentrated around.
Right,
Yeah,
I was gonna say, I know
Yeah,
high transit for is often
mhm.
helpful for. And I know I didn't follow it too deeply, but I know that there is just a House bill, trying to support, affordable housing along like, the high transit
routes,
areas
Yeah.
and everything.
Yeah,
within a
so-
15-minute walk kind of
Yeah, the
situation.
walk.
Yeah, generally
Main
kind of
arterials.
major transit stops, so it's not necessarily the whole artery, but it's where there are stops along that, and so,
Right,
yeah, 15-minute, either,
and
Kind of
not on
radius or-
ravines.
yeah, either radius or walk, or straight walk shed, yeah. So, and usually that's where there's bus rapid transit or something like that, there's qualifying factors for what's major transit stop.
Where I see potential challenges is just in, past community experience feedback, and I think that the community's come along a little bit since then, since the state has already, mandated a requirement. And now, we know what we're working with. Helping the community grow together. And so public transparency is so important in that process. So as much communications, where all the communication modes we can maintain would be best. Just to help deter misinformation and disinformation.
I see a challenge, kind of, this was brought up earlier with your comment, Karina, getting representation
Mhm.
of people who maybe had previously lived in shelters or previously lived in permanent support housing. I mean, it's really easy to assume that they are not Kenmore residents. We have shelters here, it's easy to be like, oh, we want this community to be made up of shelter at Kenmore residents. I'm like, oh, well, I could be a senior living at, downtown. And I know many people who have been long-term Kenmore residents and long-term, been here a long time, have had various states of housing vulnerability and do not feel comfortable engaging in that publicly, right? That is very private information to them. And so I think, and with many, many political and community climates, that's not something that they want to share. And so I think recognizing that we are talking about our neighbors and maybe even neighbors that we don't realize are our neighbors, and we're talking about maybe, you know, the people who our children go to elementary school with, there may be the people who bag their groceries at Safeway. And not othering them as new people who might be coming in, but they are existing neighbors that might be living in someone's garage. Or couch hopping, or maybe they own a house now next to us, but previously lived in a shelter. I think I think a challenge will be working over the implicit conversation bias that these are outsiders that are different from the existing Kenmore community.
That brings up
And that implicit bias will be a challenge the whole time.
Oh, implicit bias, absolutely, and bias for sure. But we don't want to feed the monster of it. And I love the idea of bringing in our community together. We live in a have and have not community. We live in a Title I school corridor. And so there are many families have been served by the McKinney-Vento Act.
Yeah.
And there would be a way to, engage with our district to maybe connect with some families. Many are still part of this community in different ways. And then some, come in through our emergency housing or past housing. We really don't have much affordable housing in Kenmore, so there's a huge disparity due to neighborhood gentrification, whatnot.
So I guess understanding that might be a challenge to be able to capture that perspective. How does the group think about potential ways that we could, are there people who we do feel comfortable with that? I know there are some folks who become advocates and they're more comfortable speaking about their past experiences on that, like we engage those folks. What does the committee think about ways to maybe make sure we are capturing that voice?
I mean, I think maybe the best way to do it is representation on the panel when we have panel discussion. When we have a panel discussion,
Mhm.
because my experience being involved in multiple contentious housing related, public issues is that, people who are housing insecure are dramatically underrepresented if they're represented at all. The people that tend to show up at public hearings and listening events are people that have the luxury of free time, that aren't, working or trying to make ends meet, or, need to be home with their kids during dinner, because they're frankly never convenient. Like, I even have a really rough time showing up at a planning commission meeting or a city council meeting, because that's my family time. But I think, understanding that there are a lot of people who don't have that space in their lives to go and advocate for themselves or for their future, because they're constantly in triage mode, or they don't feel like they have the presence or the ability to, do that advocacy. Like, it's so far out of what their daily life is that it's just not possible. So if we can get people on a panel that can represent that perspective effectively, and not just from the housing provider perspective, but from the perspective of people they serve, I think that might be the best way to do it. I'm skeptical of our ability to get people into a listening session or into a meeting. Yeah.
Yeah.
I mean, we had somebody who was sheltered homeless living with us for 2 years because he was wrongfully evicted from his living situation, and we thought, well, this will be a couple months. Well, turns out it was 2 years. But unless this was in Kenmore, I don't think I could get him to come to a public meeting.
I know many of very fancy professional people who have had housing crises, that they would never speak up publicly because they are known publicly as, these small business owners. They are known by their expertise, their leadership. And why would they want to publicly paint their shiny, happy professional reputation by the worst trauma? Many of us have traumas that we don't want to just be sharing around, right? Like, we don't all want to be airing our dirty laundry. And I don't think we expect most people to have to do that, right?
Right.
I think the process you're laying out, though, to bring in the organizations that represent and work with those people every day is the best you're gonna get.
Absolutely.
With few exceptions, there's very few people that are gonna give up and give public
Yeah.
testimony, right? So you might as well just.
Yeah, no, have the pros do it.
Well, that's good. That's good understanding.
Is there, I mean, based on any experience, I've started to make sort of a list of potential panel members, but if any of you have got any suggestions about from providers or other perspectives who you feel might be helpful to hear from, then, let us know.
Thanks, Dawn.
I would say I understand that in working with people who had to apply for housing vouchers. It's a very daunting process, a very challenging process, even if there's that option. And we don't really have many of those options in Kenmore. We have very few. And I don't believe we have a HUD housing requirement. I don't believe we've maintained enough affordable housing in Kenmore to keep the HUD housing certification or level of being able to.
It's like a funding resource, right?
There's a combination of between the amount of housing you have, your population, the amount of continued movement on affordable housing types to be able to meet the classification requirements for HUD housing. And so I think that's important. I know that we don't have any HUD housing anymore, but I think it's important to know if we still meet the requirements. And it's caseworkers who often are the folks who are serving our community and helping them with their process. And there's a big gap to accessing caseworkers. Many people just don't know where to get started. There's so much shame and there's so much, fear about possibly having family separation. So those are things we often, deal with or occur. And I do know with working with our community, there's a lot of seniors who are very happy to have a mother-in-law apartment and to have some level of affordability because that would help them age in place. So we have solutions in the community and partners in the community who are willing to help be part of that solution. But some of those key resources to access to starting that affordable housing journey, because many people are just a paycheck away from homelessness,
I mean, one area that might be good would be to bring in like the principal of Kenmore Elementary or somebody like that, or there's a gentleman who does a program after school for low-income kids that need help with reading and math and stuff like that, because those are people that are actually working with actual Kenmore residents, kids, whatever, in the situations that we're talking about. That
Right.
Providers,
Yeah.
aren't
He's great.
kind of the usual suspects of
Yep.
people to put on a panel.
Perfect. No, I'm curious, and I don't want to lead, we kind of touched on this a little bit. I don't want to lead the community down anyone. We talked about challenges. I think there are pretty obvious challenges around some perceptions that have been expressed at council meetings, wherever it might be. What do you all see as challenges in that department, whether it's making sure that all residents have their voice heard, or it's making sure that a portion don't drown out the other? How do you all see that kind of discussion?
I would say there's a big misconception on what is permanent supportive housing. It's a broader term, now that has more funding for resources within the housing availability. So like a caseworker, there is a lot of stigma to the former connective housing types or community serve, unfortunately. And that 30% AMI, that 0 to 30% AMI, that could be anybody who's had a medical crisis, a veteran, one of our frontline workers, that provide valuable, works, job skills here in Kenmore who can't afford housing. So understanding, what are those career types that we're looking at that fit that model, and knowing that 30% model AMI is almost above senior affordability for low-income senior housing at this point in Kenmore. So it's good for people to understand who we're talking about when we're talking about our community. Because it's not those people, they're people. They're our friends and neighbors.
Any other thoughts just on challenges to providing additional opportunities for STEP?
Time to build it.
I mean, I think the other piece is like, so I would argue that like Mary's Place and the current senior, yeah, but pretty successful in this community, right? Not a lot of public outcry. What services, what steps do those organizations have in place that Plymouth did not? Because that's the
Mary's Place had a
antithesis.
lot of outcry when it opened. I don't know, were you here when Mary's Place opened? Yeah, there was pitchforks, people
Yeah.
not happy.
Yeah.
Yeah, it almost
was-
was not open.
It was like a mirror of the experience.
it-
Yeah.
I mean, I feel like that brings up an opportunity,
Mhm.
not to digress from challenges, but I think one of the things that I've noticed is that Kenmore really lacks in having available behavioral health services and ongoing supportive services,
Yes.
and not just case management.
Mhm.
Case management is helpful because if you've ever sat on the phone for Social Security or housing or any of those fun, fantastic things that we all, get to do eventually in our lives. It's really difficult. And it's one of those things that has always confounded me about our systems, that we ask the most challenged and vulnerable folks to do some of the most difficult things. We don't like sitting on the phone waiting for Social Security. And if they have, 800 minutes on their phone and they have to use literally 500 of them sitting on the phone, waiting for Social Security, they're not gonna do it. I guarantee you, been there, done that. It's not gonna happen. So I think making and bringing in actual brick and mortar services where folks are able to go and engage, whether it's a CSO office with DSHS, whether it's, the various pieces, just for accessibility's sake, I think is extraordinarily important, especially for those who don't have permanent supportive housing supports, which the ongoing support of those supportive services in permanent support housing is really important. I think there's a huge misconception that once folks are housed and sheltered, they don't need those services anymore. And it's the exact opposite. Once they're housed and sheltered, they need those services to remain in housing. That is factual. That is based on
Yeah.
my experience in working with programs for over a decade. And without those services, then they fall out, and that's when you start to see kind of the fallout that the community really fears. So finding a way to not just build in a silo, because I think systems systematically are siloed. Medical, mental health, substance use, housing, criminal justice, it's silo city. I think the challenge is to make sure that they're connected enough that we can break down as many of those where they need to be broken down to allow more open doors as possible for folks to walk through. Now, it's their choice whether they walk through them or not, but creating the opportunities, I think, is one of the most hopeful things, because it's amazing how savvy people are. It's one of those things, I learn some from folks regularly, like I really do. And a lot of folks say, well, they're misusing the system, whether it's the ERs or shelters or jails, and it's like, well, where else are they supposed to go for these things? They don't have a clinic that they can walk into to get their psychiatric needs refilled. They don't have a CSO office where they can go to get their benefits turned back on when they don't understand why they were turned off before. They don't have a phone that they can call from to make these appointments, or an address that they can put down on a job application to go and get a job. So really, being mindful about the fact that we're working in housing, and this is our goal here, but we're not an island. Like,
Yeah.
there are other things that have to be willing to come up alongside of that,
So if you, it
within
goes,
the community as well.
yeah, so it goes a lot
I
broader than that, yeah.
also think that we need to make, at least for me, a value distinction of, so are we working in housing? Or, so some of these, so like PSH is housing. and transitional housing is a type of housing, but emergency shelter, like, those people stay homeless, right? People at Lake City Partners, they are still homeless.
Yep.
They are staying here, they are temporary residents, the really cute families that we all loved at Mary's Place, and, you know, maybe we felt really good, they went to Kenmore Elementary, like, they were still homeless. And depending on your value system, you know, there's research and there's arguments that simply making more triage and simply building out more infrastructure to keep people homeless and never building more housing is a misuse of money. And, you know, if we only build out more shelters and we never actually build out PSH, we're only triaging and we're never actually solving the problem, right? Because there's the people who qualify for PSH are not the same people who, you know, that's a very specific population, right? And so I think that while we are having these conversations throughout the summer, we need to be really nuanced and mindful and recognize that some of these services are really fantastic for maybe catching people in triage, right? Families fleeing domestic violence or emergency drop-in shelter, or maybe veteran shelters, and like those are really fantastic, and I would always love to expand those, but they do not solve the crisis. But housing is the first step in solving the crisis long-term. And so I think, you know, I think Josh touched on something that I think sometimes we feel better. You know, shelters can feel sometimes a little bit more noble. We can pitch sometimes like domestic violence shelters and like, oh, we're saving the battered women, you know, or the cute children, where it takes PSH or even transitional housing. That's a different beast to convince your community, because it's actually a solution for the problem long-term. It's no longer a triage. And so I just think while we are allocating these, I think we need to recognize these are different options. They're different levers.
And I think what we're talking about is the difference between targeted universal approaches and ground zero approaches that connect our housing partners, our behavioral and social health services to serve the community. And housing first is a targeted universal approach that's, you know, proven to work for over 30 years. And we're starting to engage some of those processes in Kenmore with like the food mobile and different things like that. Having a housing and human services director. But I can see where we could engage partners who want to be part of the solution. Bastyr University, Northwest University, the UW, who provide behavioral and social health services, mental health resources. There's been a long and outstanding cry for satellite offices in Kenmore, and we can, you know, create these mindful spaces with building or have them be a part of the solution with approach and design. And, you know, we're also overcoming a lot of the projected bias, community bias, who accesses the different levels of housing and what could they have done wrong in the world to deserve to have this point. And that's just kind of a mentality part of the community has come to display when it's actually, you know, you're a veteran who came back from war, is no longer, you know, has been honorably discharged and no longer in a hospital. Seniors, families where there's been a crisis that occurred, and code law and regulations address more egregious violent criminals versus and sexual predators versus, you know, something else. So kind of growing some volume to who we are talking about with color instead of a black and white or an absolute of who are our people in our community is what we're talking about. And our religious partners in Kenmore and a little bit beyond our borders also serve a large percentage of this community, including those who have come out of prisons, you know, or have transitional housing. That's not something that happens here in Kenmore. It happens kind of elsewhere. And also refugee housing support, but they do a lot of good work. They fill the gap where government, has limitations with the code. And there are who we often refer to when there's nothing else left for people to access. And they're often the resource before they can get access to caseworkers to connect to housing. And Section 8 doesn't just happen. It's a lottery that people are often on for 2 years. And then you might have to sit longer yet to then find housing. There's just a huge disconnect in the community on these issues.
Mhm.
And even amongst some of our elected leaders, unfortunately. So there's a large need for community education, leader education, to be able to have a quality discussion on real issues that impact our community. I can honestly say I have almost experienced homelessness. I was down to like 28 days, and I had a young family. The difference was I had a 16-year-old son with autism, and the solution that I was looking at was, not keeping our family together, because young men are considered adults, and they don't plan for keeping families together. That's the difference of Mary's Place. That's difference of like Plymouth Housing and Imagine Housing and Habitat for Humanity. They keep that reunification method and mode that's so important to sustaining healthy, happy families and communities.
You all mentioned Mary's Place a little bit earlier, and that they had very similar backlash to Plymouth originally, but don't anymore. I'm
They've
curious.
since left.
Oh, okay.
Yeah.
They've been replaced with Lake City Partners, which is a senior women's only shelter.
Okay.
Yeah.
And do they, you talked about the perception that they have in the community versus maybe what Plymouth faced when they were trying to go through the meetings. Do you think that they've done anything from an outreach standpoint, from a perception standpoint? Have they done anything that would be effective that maybe?
What I was actually poking at, there were things in their model that, from what I understood, at least mandated certain amounts of care and services to facilitate career placement and eventual placement outside of Mary's Place itself that were not in place with Plymouth in any way.
So there was all backlash originally that they were coming into a portion of Kenmore, they were coming to a neighborhood in Kenmore that was already high need. They would be draining our Title I schools. They were coming to a portion of our neighborhood that already was low on resources, high on crime. We were not going to serve the families well. That we were refabbing a police station that wasn't going to be a good fit for the families. They deserved better. We should look somewhere else. Like, you name an argument. And so if you wanted to say that they deserved better than the rehabbed sheriff's office, that was an argument. If you were going to say that we were going to drain Kenmore Elementary because they already had such the mobile home support, that was an argument. Mary's Place had so much backlash originally and so many pitchforks. And so many people we already have low-income families, we overextended, they are already coming to a specific neighborhood. We don't feel safe, they should go somewhere else.
Not in my backyard arguments. Yeah.
There's no parks, it's not safe for them, it's too cement focused. Are they gonna have a bus stop? We shouldn't have homeless children walking to school. Some of these things where it's very maybe this is a valid conversation, but I think you're only saying this because you're they were hit with everything.
Yeah.
But it's within a couple of years, because Mary's Place is regional, and regionally has a pretty solid reputation, and they had a lot of community partners. It turned out Mary's Place tenants, they didn't kill anyone, they didn't stab anyone, they were fine. They did community outreach after they were here, they integrated well, children made friends, and then everyone was fine.
But that's like pretty par for the course with how
Right.
things play out, and it's, you know, you watch this play out in Seattle when they started upzoning everything, people come out in force and they're like, we don't like townhouses, we don't like backyard cottages, and then they're like, okay, but we really do like having a secure place to live that we can afford, so
Right.
we'll take it. And I admittedly was involved in a different housing discussion in a different town when Plymouth Housing was happening here, and so I caught parts of it, and the parts that I caught were enough to make me want to volunteer for this committee when I saw the opportunity. But I think one of the things that happens with permanent supportive housing is that there's like a really big misunderstanding of what people who qualify for permanent supportive housing are actually, like, what their situation is. And the idea that, and this one gets me personally, so I'm gonna try to like get through saying this. Because my brother, died in October, and he was schizophrenic. And, he was living on Social Security disability, which barely paid his rent and his food cost, and his rent was $440 a month, and he was living in effectively a co-housing unit in Olympia. And that $440, like, really, you know, like, not well kept 2-unit, like literally 2 rooms with a sink and the bathroom down the hall, and I don't even think he had a kitchen access, was the only thing that was keeping him off the streets. And he tried to work, and he tried time and time again to go back to school and get a degree, and to, like, he just really wanted, like, he wanted a job and a girlfriend. That was what he wanted. And he wasn't able to get either of those things. And it's like, he wasn't violent, he didn't use drugs, he wasn't gonna bother anybody, everybody loved him, you know, everybody in his community was really sad when he died, and, he's not the only one, and I think that's what people miss when we talk about permanent supportive housing. It's like, well, how are people gonna get out of this? It's like, well, not everybody can get a job that is going to get them housing even at 80% AMI. Not everyone is able to work or has a family that they can live with on a permanent basis. Like, we just were not equipped to have him living, my parents weren't equipped to have him living with them. So I think the messaging, and Karina, you touched on this quite a bit, the messaging of, like, who does permanent supportive housing serve, and why is it permanent? Like, why is this not like this? You know, when you look at populations of, show you my new book I'm reading, but when you look at populations of homelessness, the vast majority of people are not like drug addicted or, you know, have severe mental health problems. That's what, 25% of people who are experiencing homelessness. So we need to serve the 75%, but we also need the people that are never going to be able to afford even affordable housing need to be cared for in some method, because it is inhumane to do anything else.
And it's what's lacking in our community. We have very little emergency housing. We have very little senior affordable housing. We have 0 workforce housing. Workforce housing is like 40 to 60%.
And I think.
And then 80% is what we keep hearing being offered to community or in policy direction. Well, this is about what we're aiming for, and 10% or 20% of that housing, hopefully it's supposed to be 30% is what I recall. But 10%, you're talking about 10 units. 10 units does not serve the amount of population need we have when you design a new building that's already now. We have a lot of families that double up, and just the difference between building types, you know, if you talk about middle housing, there's solutions of, you know, duplexes, triplexes, but you can't get to affordability until you get to 4 units, and that becomes commercial housing. And so here we are back at the areas that we need to address. And we've been fearful, you know, in the community, or community leadership hadn't been there yet, and the community hadn't been there yet to grow with these issues of need. But we have to make it happen, because we can't any longer continue to contribute to neighborhood gentrification or contribute to bias. And a lot of these housing types are required by code and by laws to have, social workers and caseworkers and a high level of support, job worker retraining, but a lot of community just does not know that.
I think, I want to thank you so much, Catherine, for sharing
Yes.
that. So I've worked in support housing as one of the outside support
Mhm.
staff who came in. It was my first exposure to, it was a refurbished hotel for, veterans. It was my first exposure to homelessness, right after my undergrad. And I want, so I just want to say that I'm very, very familiar with permanent support housing, and I love it, and I'm very supportive of it, but I also want to echo, I think something that Jennifer touched upon is when we have a shortage of resources, you have many people who are mismatched in and misusing, I don't like that term, they're misusing services, right? Like you're going to the ER for something that really isn't an emergency because they're just trying to get their needs met for medical care. And I think when we know that we're in a housing crisis and we have something like permanent supportive housing, there is, I think it's a very valid fear that what if everyone who is in my neighborhood permanent supportive housing, what if they don't all fit there? What if some of the people there are higher needs and they really should be somewhat institutionalized or something? And what if some of the people who are in there are really just kind of like my grandma and this PSH building because with something that is different than the model that was pitched to me? And I think that that is a very valid fear that we need to recognize that people have. Because I think that when, like I can tell my immigrants and the refugees that I work with that their emergency room experience is going to be a certain way, but in reality, there's going to be the hiccups of real life of people misusing that service or really long lines and right. And so I think we need to somehow navigate the fact that people are going to have, so whether this is through better information or better clarification of what the intake process is, but I think that there is a very valid fear for people, or how do you make sure that just the homeless sweet grandmas are not mixed in with the people who maybe need to be institutionalized? And how do we make sure that this is not just a mismatch of services because the housing crisis is so bad that everyone is just trying to get the housing they can get? And
It's,
I think that's a valid fear that people have.
I think you make a good point that it's something to recognize that people have that fear and it's legitimate in terms of it may not, right? We may have different ways to address it, but it is a concern that a lot of people have, and it may manifest as someone being against permanent supportive housing when that's not really.
I love
perception of that,
I've worked
right.
with it, I've advocated for it, but I am for permanent supportive housing for the people that it's for. I've also worked in psychiatric spaces and for other senior spaces, and I recognize that not everyone fits. And we need to have the best fit, right? Housing first is not housing only, and it only works assuming it is housing first and not housing only. And so I recognize that these programs only fit assuming people are slotted in their appropriate spaces, right? And I think people having, concern, recognizing maybe vulnerabilities that they've had with their own veterans or with their own grandmas or with, their own violence in their own family and say, oh, we're having a lot of vulnerable people. How will they fit? How will this fit with my family? I don't think that fear itself is something that we need to, we don't need to villainize anyone for. We need to clarify and we need to answer that very, very clearly.
Mhm.
And if we can't answer that, we need to make the system as a whole answer that better.
Yeah.
True. Now there's better
Sorry.
separation of, wet and dry housing, right? Because we've evolved a bit for understanding housing types and people who are newer coming out of recovery versus people who had been homeless and newly housed and still working through recovery. They don't typically intertwine these two groups in healthier model practices. You're not going to see that in Imagine. You're not going to see that in Plymouth. You're not going to,
You gotta mitigate the risks.
yeah.
You
Right,
don't
which
usually
is-
put the DVs with the veterans.
Right,
Like,
exactly.
That's
Specialize-
Yeah.
that's my point with
Yeah.
the Mary's Place versus Plymouth. they mitigated the risks largely. Couldn't drink, couldn't do drugs, all that kind of stuff. That wasn't true with what was proposed for Plymouth, so.
So some of this is gonna be PSH everywhere.
Yeah,
If you look into PSA,
Yeah.
if you did the.
I'm just saying, like,
Yeah,
in
yeah,
terms of bringing a community along,
Yeah.
right? Because you gotta think for the people who own homes and businesses and whatever, right? Their entire life savings largely is sunk into these properties. And so when you do that and you put it right in the middle of the town,
along a transit line,
you're gonna have
you'd rather have it by the.
high,
Aqua Club.
high risk, right? When you mitigate the risks, I think you'll find the community more open to this sorts of things.
And sorry, real quick, do you wanna,
goes back
Okay.
to bias, the thoughts of bias or the presumption of bias that were part of the
I don't think it's
stigma.
bias, Karina, though. There's like very hard facts of the crime associated with Plymouth, right?
They're different locations.
I know, but like,
And
there's like
also,
hundreds of calls and people that are murdered in these facilities, so like. The risks,
again,
If you
risks
want
are
to
not,
dive
Speak
into
to that, let's
actually
just stay
about
on point.
calls From related to homelessness, I would happy to dive into research.
yeah, I think we need to stay on point. There are
Yeah.
different housing models, different locations that deal with different things. And for many of these issues, there was a absolute agreement and,
I don't think. we
and
need to
contract,
research at all.
but it's the same with, as it was with Mary's place.
my only we're gonna end up making recommendations for all of these types of housing.
Right.
The way you bring the community along though, is to show that you've thought about the positives and the negatives.
Right.
And you've addressed the obvious concerns.
yeah, I think to your point. You don't often make a lot of progress by just seeing one side of any issue, you
Yeah.
have to kind of address each side.
We do.
I do, Debbie, I wanna
Mhm.
check something logistically, I think we were set to run 4 to 5, and I wanna make
Yeah.
sure that,
I
you know,
was gonna call on that.
Yeah.
So I think, so I don't wanna.
I never wanna interrupt good
It's a
conversation.
great conversation and I don't want to limit it, but I also want to be mindful of the time, because we said an hour and there's still a couple of things that we need to get to, right?
Okay.
And the
Well, we just
agenda.
have a little bit more in terms of just, I think this is the last slide of just,
I'll just throw out real quickly, to be able to sustain housing once you have housing of any of these types, there are rules you have to commit to. And most people are so afraid of losing housing that they're not willing to break those rules. And that's a lot of evidence behind and facts to support that. And I think that's good for us to at least acknowledge and moving forward.
yeah, and I think Debbie earlier mentioned, some research into good neighbor agreements and those types of
Yeah.
things where people can have an understanding of some of those rules and what they might be.
Yeah.
So, I guess any closing thoughts by anybody before we kind of go to next steps? And certainly not our last meeting.
Microphones would be nice in the space.
Sorry?
Microphones would be nice in the space. It's really hard to hear this end of the table. And some people are low talkers. So it's hard to hear.
We were supposed to be in the community meeting room, but there's another meeting going on tomorrow, and so it's not, this setting is not ideal, but we would be in that it'd be a smaller space in the community meeting room in future, so hopefully that may make it a little easier, but I can look into that too.
Okay.
For microphones.
Well, so I'll close out this portion just by saying we'll meet monthly. We don't have a set date for next month's meeting. We will send that out as soon as possible. I don't know if you've locked down a date yet or not, but
I haven't, and I think, I can have Shannon send out a poll again. I don't know if this time makes sense for everybody at the time, or if it just happened to be that this particular Wednesday worked. So I can have send out a poll to try and find out a best time and date for May. So we're probably looking at sometime later in May. For the group, I'm also looking to try and get a panel together. So if anybody has any suggestions who you think might be a good person to sit on the panel, please let me know. So that's kind of where we are, unless we can kind of take a look at the calendar now, sort of say if we were looking at, follow-up meeting. Would be sort of like towards the end of May,
Yeah.
not running into the holiday time, which is on the.
Yeah, it is a little tough when we come up on
It's a
summer.
little tough.
And I think some of that will also depend on maybe the availability, because we do plan for the next one ideally to be with that group of experts.
Yeah,
May come up on the availability of that group as well,
yeah,
so.
so it's gonna be a little tough. So we might have to stay tuned. So my goal is to try and get a panel. And then that would then be, you know, we'd rather have that meeting, and we could meet shortly after that then to kind of debrief from the panel meeting and what you've heard and how that then may lead into, you know, some questions on developing regulations or community engagement to address some of the issues that you brought forward this evening in terms of, you know, there needs to be obviously a lot more facts and information out there in terms of, community education, community engagement, if there was a project. I think those are some of the common themes that I've heard tonight, and also making sure that when people who are on the panel can either speak not just with the voice of a provider, but kind of give sort of some perspectives and feedback from, you know, the people who actually have experienced that kind of housing, or that have that lived experience. So those are some of the key things I heard from right now.
I would agree with that, yeah.
The only other thing that would be helpful would be like, what do we think is the best in class?
Wait a minute.
Kenmore isn't the first town to address this stuff, right?
Mm.
Like it's been, I don't wanna like reinvent the wheel. Like, right, like, all of the
Yep.
debates we're gonna have already been had 1,000 times over, right? So like, are there communities out there that adopted XYZ zoning rules and whatever that we think, hey, this is a great place to start, and we just need to localize them to this specific town?
So that's something that we could bring back, is look at some examples from other jurisdictions, whether that's in terms of regulations or community engagement plans and things like that. We can bring back examples that people already put in place.
Absolutely.
Yeah, we can absolutely do that.
Well, so any materials that we want you all to review prior to a meeting, you'll have 1 week before a meeting, so hopefully that's enough time to be able to review. Please, if you get those materials, in order to be active, good participants, be able, you get the chance, please review those. And then I just want to say, thank you so much for volunteering to be on this committee and for sharing everything that you all did share today. It's a group of strangers, and a lot of people shared some very emotional, intense things, and I appreciate you feeling like you could do that with this group. So looking forward to additional meetings and to seeing ultimately the recommendations that this group makes.
So one housekeeping thing, if anybody needs a stipend to be able to, you know, attend or participate, the city can offer it's a $60 per meeting stipend. I'm working with the finance department on so the procedures and a form to get that in place, but I'm putting it out there that there is more to come, and once I have that information in the form, I will get that out to you. It will be relatively easy, but that stipend would be available per meeting. So more to come on that. I apologize that that's not ready to be in place today.
Okay. Well, thank you all.
Thank you.
Enjoy the sunshine that we had out there.
Good discussion.
Yeah, I think. Perfect. Guess we'll leave our name tags here.
So Debbie, you're just gonna do the poll for the next meeting, so.
I will get, yeah, you'll probably receive an email from Shannon on the poll for the meeting, yeah. Sorry.
No, you're good.
Thank you. Hopefully we can get a chance to enjoy a bit of the sunshine.
Absolutely. Thank you.
Thank you all.
This corner off.
We'll take it. I shouldn't say it. The city will take that.
That was very, yeah. I don't think there's any bad spot.
Well, it's not in the library. It's not just-